MLT Case Study Series 23. A case study on the topic, Deciphering Diabetes, a comprehensive case study for medical lab technologists. Navigating through the maze of laboratory diagnostics to unveil the glycemic control. Introduction to diabetes. Diabetes mellitus is a metabolic disorder characterized by high blood sugar levels over a prolonged period. It is primarily classified into three types: type 1, type 2, and gestational diabetes. Diagnosis often involves assessing symptoms, measuring fasting blood glucose levels, oral glucose tolerance tests, and A1C tests. Objectives: understand the diagnostic criteria for diabetes. Interpret laboratory results in the context of diabetes. Recognize the importance of accurate laboratory testing in managing diabetes. Sample case study. Patient background. Name: John Doe. Age: 45 years. Sex: male. Medical history: hypertension, family history of type 2 diabetes. Presenting complaints. John presents with increased thirst, frequent urination, unexplained weight loss, and fatigue over the past 2 months. Physical examination. Weight: 85 kilograms. Height: 178 centimeters. BMI: 26.8 kg/m(2), overweight. Blood pressure: 130/85 mmHg. Laboratory tests. Fasting blood glucose, FBG 126 mg per deciliter. Oral glucose tolerance test, OGTT 200 mg per deciliter at 2 hours. Hemoglobin A1C, HbA1c 7.2%. Lipid profile. Total cholesterol, 210 mg per deciliter. HDL cholesterol, 35 mg per deciliter. LDL cholesterol, 145 mg per deciliter. Triglycerides, 250 mg per deciliter. Diagnostic interpretation. FBG, a level of 126 mg per deciliter, is above the normal fasting glucose range, 70 to 99 mg/dl, indicating diabetes. OGTT, a 2-hour glucose level of 200 mg per deciliter confirms diabetes, diabetic range, greater than or equal to 200 mg per deciliter. HbA1c, a value of 7.2% is above the diabetes diagnostic threshold of 6.5%. Supporting the diagnosis. Lipid profile. The lipid profile suggests dyslipidemia, common in diabetes, characterized by high total cholesterol, high LDL, low HDL, and high triglycerides. Case discussion. John's clinical presentation and laboratory results confirm a diagnosis of type 2 diabetes mellitus. His HbA1c level indicates poor glycemic control, suggesting that he has been hyperglycemic for an extended period. The abnormal lipid profile further supports the diagnosis, as dyslipidemia is often associated with type 2 diabetes. Management and follow-up. The management of diabetes involves lifestyle modifications, diet, exercise, blood glucose monitoring, and possibly medication, e.g., metformin. John should also be counseled on the importance of managing his blood pressure and cholesterol levels to reduce the risk of diabetes-related complications. Regular follow-up appointments are crucial to monitor his response to treatment and adjust his management plan as needed. Conclusion. This case highlights the critical role of medical lab technologists in diagnosing and managing diabetes. Accurate interpretation of laboratory results is essential for confirming the diagnosis and guiding treatment decisions. Continuous education on advancements in diabetes care and laboratory techniques is vital for healthcare professionals involved in diabetes management. Thank you. Please subscribe for more videos.